Good morning, good afternoon, and good evening, and welcome to this special presentation and promotion for Kennetic-Fit and Wellness and Holistic Psychology. My name is Kenan Wesley Mason. I am the founder and CEO of Kennetic-Fit and Wellness, and I want to present to you some information and an offer to you, the viewer, on how you can potentially benefit from holistic psychology. First, again, my name is Kenan Mason. I am board certified as a M.I.N.D.S holistic psychology practitioner, have been so since 2011. And M.I.N.D.S stands for Mind Inspired New Dynamic System, as created by Dr. Dolores Seymour. Officially, back in the late 70s, early 80s, I think she officially had this curriculum since 1982. Since 1982. And so I've been board certified since 2011 and accredited under the American Association of Drugless Practitioners. So, and I say this because unfortunately, this specific avenue or realm, if you will, of psychology is little or not well known at all to the general public for a number of reasons. Anytime you have something of a holistic nature come to the forefront to the general public, some people question the validity of the practice, which is actually a good thing because it allows me to bring this presentation to you and also to give you information on, again, how you can benefit. So what is holistic psychology? So holistic psychology goes into the root causes of life challenges, the root causes of one's life journey, the root causes. If anyone has had adverse circumstances throughout their life and they seem to keep repeating themselves over and over and over and over again, it's because we've established a very well grooved pattern in our brain, which manifests in our daily reality. So holistic life counsel allows the person, the individual, to go back and reassess what has occurred within their life journey. And from there, I give tools and techniques so you can become better. So you can become better. So you can have some aha moments, um, based on certain symptoms that have built up over the years. Symptoms, whether they be physical or psychological. Now, holistic psychology is not clinical psychology. Holistic psychology is not clinical psychiatry. So I won't be diagnosing any person of a, quote, disorder. That's not what I do in my profession, to tell you who you are because of your behavior patterns. So you won't be diagnosed with having social anxiety disorder or borderline personality disorder or what's called general anxiety disorder or any sort of depressive disorder. I won't be diagnosing you as having bipolar depression. That's not what you'll be. That's not what you'll get here with holistic psychology. And the reason is because all of those disorders have energy. They have an energy attached to them. So every time someone introduces themselves and tells their story of having bipolar disorder, or telling the other person, "Hi, nice to meet you," I have multi personality disorder or borderline personality disorder, or I'm been diagnosed as being manic depressive. And many people, possibly yourself, the one that's viewing right now, possibly you've been diagnosed with a quote disorder. And for those that have disorders, this can become stressful over time. It can become stressful because you have to maintain this part of yourself, this part of yourself that's been cast upon you by a clinical psychologist or clinical psychiatrist. So that's what holistic psychology is not. Also, holistic psychology does not prescribe medication or synthetic drugs as a remedy, as a healing remedy, because drugs, as we all know, it doesn't matter what the source is, uh, all synthetic drugs have an adverse effect on the human body, whether it be the brain or the heart or any of your other vital organs, particularly the liver and the kidneys. They all have effects to varying degrees depending on how the individual responds to the ingestion of multiple medications. And there are some individuals, possibly even yourself, that are currently taking 2, 3, or 4 medications for 2, 3, or 4 mental diagnoses, right? So I'm going to go over this here. I'm going to pull something up on the screen here for all of you to just take a look at. And this right here, these are symptoms. And I want everyone to really take a look at this list here and see if anything on this list applies to you. If anything on this list applies to you. And this is just part of the list here, as we see standard or general anxiety or anxiousness. Anxiousness. Also, as I mentioned just a minute ago, social anxiety, social stresses. Many people have complained about perpetual episodes of panic attacks, chronic depression or chronic sadness, not knowing how to move forward from certain experiences, post-traumatic stresses, impulsivity or impulsiveness, acting on impulse, acting on impulse versus uh, versus a cognitive thought or cognitive way of thinking or conscious way of thinking. Irritabilities, people that become irritable or irritated by things. Compulsions, irrationalities, as many people have what we call uncontrollable irrational emotions. Anger, anger. Many people have had episodes of anger, and many people have been uh, prescribed to go to anger management classes, meaning that in this case, it's interpreted that anger is a bad thing and therefore you need to suppress it. Well, in holistic psychology, we look at anger just like any other emotion. We look at it, address it, confront it, and then we use it to our advantage. We use it to our advantage. Anger, hate, annoyances, other stressors, resentment. Resentment is a big one. And many of you may have resentment towards a family member or towards a friend that may have done you wrong. Guilt for something you may have done to someone else. Grief and grudges, having grudges, feeling despair, not knowing if your situation or challenges will ever be resolved. For the long term, I mean, resolved where you don't have to go back to it ever again. Relationship challenges, relationship challenges. whether it's a domestic relationship, romantic relationship, uh, friendships, friendships that may have gone wrong for varying reasons, relationships, business relationships. So, all relationships of all dynamics, separation. Many people have challenges with separation from a relationship, for example. Physical illness, and physical illness, a root cause of certain physical illnesses can be nutritional deficiencies. And nutritional deficiencies can have an adverse effect on how the brain operates, because the brain has to be fed just like your stomach has to be fed. The brain and the mind, they both have to be fed energy from either outside influences or formulating your own thoughts and creative your own creative influences about yourself. Weight loss and weight gain. Many people have struggles or either have struggles or challenges with weight loss and weight gain due to their daily stresses of life, not knowing how to confront those stresses, not knowing how to resolve those stresses. And all this negative energy builds and it builds and it accumulates and it accumulates until it creates disharmony, or what we call dis-ease in the body. Weight loss and weight gain, feeling hopeless or helpless, not knowing, again, if you're going to ever be able to come out of this rut that you found yourself in for possibly 5, 10, or 20 years. And then, because of all of this, we believe that we have to be prescribed multiple medications to resolve this. Pharmaceuticals and prescription drugs. And then if we move up here, there's even more. Workplace dilemmas. Many people have challenges in the workplace or in their place of career. Some people have challenges starting over, starting a new career, wanting to have some guidance on their career choices, whether they should go this way with their career or whether they should go that way with their career. Body image. Many people have body image challenges because they've been hard on themselves because they want to be like possibly the images that they see on television or in music videos, possibly. There have been multiple influences, especially on women, that have taken it upon themselves to change their body image through surgical procedures, thinking that this method will change their ideologies about themselves. So, body image, feeling inadequate, having inadequacies about their body image, hurt and pain based on past experiences, sensitivities based on past experiences, vulnerabilities based on past experiences, abuse of varying dynamics, whether it's abuse, verbal abuse, emotional abuse, and physical abuse, which is a big issue with many couples today. Self-perceptions, disappointments, animosities, lacking motivation. People lack motivation. They're not motivated to do something new, do something different, do something that'll challenge their ideologies, something that'll challenge themselves. What motivates you? What gets you out of bed? What do you have a passion for? Lacking confidence. People don't move forward because they lack the confidence. Lacking accountability, which simply means taking 100% responsibility, or the fact that you're not taking 100% responsibility for your life journey, for your experiences, and your role within those experiences. Neglect or abandonment. Many people have challenges with this according to how they grew up in their childhood environment. These are factors of why people have, quote, mental challenges, or just challenges with their behavior patterns or challenges with their demeanor with others. Being emotionally numb or having apathy, and many times this is because of the multiple drugs that are being administered and being ingested on a daily basis, which makes some people or many people numb to the world, where we develop ultimate apathy, where we have no real emotion for anything. We're just numb. Lack of self-love, lack of self-love. And all of these symptoms here can occur because of lack of self-love. Again, going back to childhood experiences, what were you told as a child about yourself? What were you told? Negative emotions, negative emotions. Knowing what you want versus what you don't want. Knowing what you want versus what you don't want. And there is a huge difference and distinct difference. And you have to, or it would be best to consider to learn how to make the distinction between the two, what you want versus what you don't want. Attachment and detachment. Many people have challenges with attachment to things, being emotionally attached to things, being emotionally attached to people. And then they have the fear of detachment, right? Detaching from the thing, being detached from the person, or having withdrawals from the person. We all go through emotional withdrawals in our lifetime. And then the fear of moving forward, the fear of the unknown, as we see that fear is an acronym. Fear is an acronym for false evidence appearing real. False evidence appearing real, meaning that because you create your own reality, we fear the unknown. We fear what our capabilities are, right? So fear is something to overcome. Fear of phobias, fear of being social, fear of criticism, fear of criticism. So yes, fear, and fear is probably um, the biggest emotion that we face. Fear, and fear is just based on our negative ways of thinking, right? Not having enough information. Many people fear because we're ignorant to information. Fear. So, do any of these apply to you? Do any of these apply to you? It may be one thing that applies to you. It may be multiple things that apply to you. As I come out of here, you know, as I talk about mental illness, I think about my brother and how for the last 2 decades, he's been having a up and down battle with his mental challenges as he was diagnosed with he was diagnosed with having um, paranoid schizophrenia. That was his official mental diagnosis. And prior to that, he was diagnosed at the age of 14 with having osteogenic sarcoma, which was very emotionally devastating for him at that young age, going through his adolescent years at that time, not knowing how to emotionally handle that diagnosis, and also not knowing how to uh, release all of the therapies that were administered to him: chemotherapy, multiple um, medications, and this literally drained the energy out of him for quite some time. And because of this, he's been having an up and down battle with his mental health as he's in a facility right now as I'm speaking, doing this promotion. And just thinking about it right now, it reminds me that these mental institutions are just a half step away from being like a prison, being like a prison. And unfortunately, because it's under the standard mental health system, the patients are forced to take their daily medications. And my brother has been prescribed medications like Cymbalta, like Lexapro, like Seroquel. And these have devastating um, adverse effects on the brain and the body. When I think about mental health, I also think about my sister when she was in elementary school and she was having behavior challenges because of my brother's diagnosis, because my mother had to take her attention away from my sister and give more of it to my brother to care and comfort him, which meant that my sister, being 5 or 6 years old at the time, this was back in 1995. And so, because of this, the school that she attended, because she was going to a private Christian school, they diagnosed her with having ADD, ADHD. And the first medication they wanted to prescribe for her is Ritalin. And because my mother did her due diligence, she chose not to have Ritalin prescribed to her because of the effects that it has on children and their behavior patterns, or lack of behavior patterns, because drugs like Ritalin literally make the body and the brain go numb. And for children, this can have a huge adverse effect on how they grow up to see the world. So when I think of mental health, I think of those two incidents with my own family. And I'm pretty sure that many, if not most of you, know someone that, whether family or acquaintance or friend or coworker, that have had issues or situations or challenges with personality or behavior or mental challenges. And they've been diagnosed with many of the symptoms that I showed just a minute ago. So this is very close and dear to me because of because it happened in my own family, as I'm sure it may have happened in your family. It may be happening to you right now as we speak. So why holistic psychology? Well, again, I don't diagnose. I don't prescribe medications. If you have a functioning brain, then holistic psychology may be right for you. Because in all sessions, this is about making you better by stimulating your brain through certain exercises in each session. Exercises that stimulate your brain, stimulate your assessment of yourself, stimulating an assessment of your own life journey, um, forcing your mind to really take a step back and consider or rewind everything that's occurred. Even if it's things that you don't remember, it's okay, because it's all about how you feel about yourself right now. How do you feel about yourself right now? How do you want to feel over the next 6 months to a year? How do you want to feel? So, my offer to you is to give holistic psychology some consideration. Some consideration. If you've gone through the matrix of having prescription after prescription over the last 5, 10, maybe even 15 or 20 years, if you've gone through multiple medications and you still feel like you haven't progressed into what you consider normal for you, give holistic psychology some consideration. As Earl Nightingale would say in The Strangest Secret, you have nothing to lose, but everything to gain. Why? Because there are no harmful, quote, side effects. There are none. There, there are no side effects. And also, this avenue of psychology has been scientifically and clinically proven. Because here in America, we like to hear those phrases when it comes to health matters. Holistic psychology, as created by Dr. Dolores Seymour, has been clinically proven, has been scientifically proven. But I always say that even if it wasn't scientifically proven or clinically proven, it would still work because of the universal order of how the human brain operates and how the human mind operates. And keep in mind that the brain and the mind are two separate entities. They're two separate entities. So keep this in mind, and also know that you can dial your number. You can dial the number on the at the bottom of the screen and contact me. Contact me. Leave a message and tell me about your situation. Tell me about your situation. And you can also tell me how you would like to be better, what you would like to see for yourself, how you would like to come out on top, how you would like to feel among this process. And it's not a quick fix process. This is you taking the time to acknowledge you, taking the time to focus on you, because we tend to take care and focus on everybody else and everything else except for ourselves. And then we go further and further and further down the totem pole. Now you have an opportunity to take yourself up higher and higher and higher on the totem pole, focusing on you and allowing yourself to make yourself better, allowing yourself to confront yourself, allowing yourself to see yourself in a better way, in a better light. So dial the number on the screen. You have nothing to lose. You have everything to gain. This is Kennetic-Fit and Wellness. My name is Kenan Wesley Mason, holistic psychology practitioner, and I can't wait to hear from you.